is Thursday, September 24th. Watkanurados Uruguayo, Joe Delaronio Jets. Welcome to the Kahnawà COVID-19 Task Force update. This is our 132nd update. And joining us today will be Lisa Westaway. And of course, as he has been on most of these updates, Lloyd Phillips, who is the Commissioner of Public Safety. The news out of not only Quebec but across the country continues to be alarming, to say the least. So we're going to talk about Kahnawà's actions and plans and just give you an update on where we're at. Lloyd?
Thank you once again, Joe. Good afternoon, everybody. Yeah, certainly if you've been watching the news in the past couple of days and the situation throughout the province of Quebec is certainly not heading in a good direction. And a matter of fact, even though across the entire country, even yesterday, the Prime Minister of Canada, Justin Trudeau, had made some very alarming statements that basically worried about the direction the country is going, and he's worried about looking at a future lockdown like we've seen earlier in the year. So coming from high levels of government like that, it certainly is alarming for people to hear such things. But what I want to talk about today a little bit is obviously the Kahnawà plan and how we laid out various steps using colors to have the level of alert assessed locally, not based on the what's happening in the South Shore, Montérégie region or Montreal region, but what's happening locally, and determine the color of where we are, based on several factors, which I'll touch on again in just a minute. But before I get into that, I just want to update you as well. Today, the number of COVID positives in the province of Quebec continue to rise, like 581, I believe it was today. So again, alarming numbers. And the roll-in 5-day average, was over 500. And we haven't seen those types of numbers since, sometime in early May. So it is, again, it is alarming, but things are not necessarily have to continue down that path. If you look at what is being asked, not only here in our community and previous episodes of Facebook Live, but obviously the Premier of Quebec and the Prime Minister of Canada pleading to their population on being vigilant now, taking measures seriously now to avoid a catastrophic outcome in the months to come. Nobody certainly wants to move down the path of closing down businesses, about going back towards lockdown, and I guess the power is certainly with the people to be able to determine the direction. And also I want to reassure the community, even according to our Kahnawà plan, the thing we want to avoid the most is to return to a state of lockdown. Our priority is not going to be trying to close businesses or asking business or demanding business, however you want to phrase it, to close. We want to make that one of the last measures, and we'll only start seeing that in the latter part of an orange phase, or if we move into a red phase where we actually have to seriously look at the impacts on the community and how that impacts the business establishments in the community. But as we always said from the beginning, those determinations will be based on the science, and the health will lead the way, and those determinations will be made in accordance with the latest data. And as was mentioned a couple of times, we look at several factors when determining where we are within the pandemic and what level we're at. Obviously the total number of cases within the region and also locally in Kahnawà, the percentage of positive tests that are done and versus the total amount, the percentage of positive, I should say, versus the amount of tests that were done. Also, our ability to do contact tracing, which is also very important, because as soon as you get a positive case, you want to be able to quickly contact trace any possible contacts that person may have to be able to limit and contain and isolate the spread of the virus. So that's another major component that we look at. And as well, locally in Kahnawà, we watch very closely what's happening around us, what's happening in the Montérégie South Shore region, what's happening in Montreal, and the possible impacts on our community. So the chart that we came up with, well, we were originally going to work in phases, phase 1 to 4, and put that out in such, 1 being lesser, 4 being more severe. But given the fact that the colors seem to be what is being used not only in Quebec but nationally and internationally, we decided to make it clear. We'll also adopt the color scheme as well. But keep in mind, what's in our yellow or orange or red phase may not always be the same as what's in Quebec's or Canada's. So just keep that in mind. So when you're looking for information on what the criteria is, it will be make sure you're looking at the Kahnawà COVID-19 documentation, which will be released in just a couple of hours from now publicly. It'll be pasted on our Facebook page and also made readily available throughout the community very, very soon. So I'll show you real quickly here on a graph, if you want to pull it up there, Buenadio. We have outlined is you see green, yellow, orange, and red. I know it's difficult on TV to see this, but just to give you an idea, if you look at the green, and a matter of fact, green, we never achieved the green, because this plan was first drafted in July, and we've been updating it ever since. We never achieved the green because, as you know, as we speak today, there is a pause on further opening of businesses. There is a pause on further numbers of gatherings, and we never opened the bars in the community, so we never achieved the green zone. So we are always in a state of what turned out to be yellow, and we are still in the yellow phase at this point. Which includes obviously maintaining the state of emergency that we're currently operating in. And again, the purpose of the state of emergency is to give legal effect to the measures and directives of the task force, and allowing the peacekeepers to do what they got to do from a law enforcement capacity, if that is the case, and also make sure that whatever actions we take is under Kahnawake jurisdiction and not utilizing any external legislation to achieve the goals on what we need. It also talks about travel. Right now, other than going into the U.S., obviously that border restriction is still in place. That's not a task force decision. That's a decision that's made by Canada and the U.S., but there is still that border restriction there. There's also some restrictions if you want to go from Quebec into the maritime provinces, that there's very strict regulations on that. But for the most part, from a task force perspective, there is no restriction for Kahnawake to travel, in Canada, for either business or pleasure. However, there may be advisories or warnings put out, for certain regions, although there is no restrictions. There's also discussion at that point in time on the visitation to Category Memorial Hospital Center, Turtle Bay Elders Lodge, ILC, things of that nature also have to take into consideration when we're into a yellow phase. And basically, businesses that are operating, will continue to operate. They have made their physical changes to their environment. They had personnel changes and such, so that they can operate. We seen in June, when things first start opening back up, with the plexiglass and hand washing and the distancing measures that were put into place in the establishments, only so many people allowed in the building at one particular time. Those measures seem to be adequate to halt the spread of the virus in those areas. And we're hopeful, by being extra vigilant in those areas, maintaining those measures, that it would help again to minimize the spread of the virus. So in the yellow phases, we're not talking about moving to further minimize businesses in any way. Obviously, maintaining schools and with their adaptations as well is important. Gatherings remain maximum of 50 in public areas, 10 in your private residence. And that's a question we get often. People say, well, is that 10 inside and outside, or is it a total of 20? that is easiest way to explain it is that's 10 people on your property, whether there's 5 inside or 5 outside, or 4 and 6, for example. It's 10 people, within your property. There's other areas that were allowed to open and operate in terms of leisure activities, sports, recreation are done with modifications. Community organizations are operating, again, obviously with several adaptations and modifications as well. We have been maintaining a space for emergency shelter if need be, as well as emergency food services are still operational and remain on standby if they're called upon. And as things evolve and if things get worse, in and around the community, then we would put out an alert and we would definitely move to the orange, which again is it corresponds to a higher level of community spread in the community, and community spread not necessarily in Kahnawà, but community spread in terms of the province and the areas around us. Community spread is just a terminology that's used. It doesn't necessarily mean it's in the community itself, but it may be in the future. So we got to be very careful of that. But it means basically we're going to have enhanced measures. So what we have now, if we move into the orange, there may be more restrictions that will come into place. There may be further restrictions on visitation at Kahnawà Memorial Hospital. There may be more restrictions that businesses would have to adhere to, more restrictions for organizations that we may have to adhere to. Public gatherings and private gatherings, there may be further restrictions. So things of that nature, would kick in during the orange phase. There may also become travel restrictions, either no travel outside the province and or within regions within the province. As you may recall, at one point in time, we were advising people not to go to Montreal. That was going back in the height of the pandemic during April and May. We're not at that point yet, but if things evolve, and that may very well be a measure which we want to put in place for the community and advising the community accordingly, if and when that time comes. And obviously when things continue down the path, and we get into a red zone, obviously that means a significant increase in the level of transmission of the virus, and that we need enhanced measures to control the spread. And that's where we're talking about there may be restrictions on travel, maybe stay local. As you may recall in the past, we were saying about stay in Kahnawà as much as possible. Go to Chateauguay or other places. Pick up your groceries, do what you got to do, but return back to Kahnawà as quickly as possible. These are types of things that we may come across if we move into a red zone. There may be possible restrictions to access to the territory, as we've seen in the past. There may be at this point in time into the red zone. That's where there may be looking at. Some businesses may have to further modify the way they operate, and or there may be a possibility of some closures if things really get bad and when we are in the red zone. There may be some stay-at-home directives, for example, as well as the stopping of sports and recreation or leisure activities in the community, moving to essential services only for community organizations. And as well as enhancing the social cycle support in the community, enhancing the food basket services or emergency food services in the community as needed, and implementing other support mechanisms as required to assist community members. Those are all the areas that would kick in during a area in which we would deem to be red. So we have a progression from yellow, orange to red, where measures would be increased as we go along. And again, I know I covered this document very quickly. There's tons of information in it, but it will be posted on the website in the next little while. But just so you'll know as well, in part of the planning, a version that looks like on the screen there, and one of you has it up there. It looks something like this. That will be posted soon, but. As a working document, again, just for community to know, for each one of the measures that are outlined there, there is a detailed plan that at a task force level and at a level of various organizations who are deemed to be responsible for certain parts of the plan. no, there is a much more detailed action items for each specific point that's in there. No, we didn't want to overload the community with too much information, but I just want the community to know that no, there is no significant other information, no, that breaks it down, no, much further, no, on each one of those areas, and as needed, the organization or the person responsible for the details, obviously including the task force, will be done, and the plan and action items will be set forth so that it rolls out as quickly and as smoothly as possible, to the community. And as we are implementing various measures, if need be, in the community, with these various action items that are important to make sure it's done effectively, those, at that point in time, that information will be released to the community in very specific communiques or press releases explaining clearly what is happening or what is about to happen. So, very complex plan. I know it's a lot of information already. It will be posted on like I said, in the next little while, so people can look at it in more detail. I just want to reassure the community that there, again, like we've seen in March and April, all hands on deck, as I mentioned before. We're working here very diligently to ensure whatever measures are needed to keep our community safe are put into place as quickly as we possibly can and at appropriate time. We don't want to wait too long until we go on a path and we realize that we should have done something sooner. But at the same time, we want to have people be able to live their lives in a normal fashion as possible, as long as possible. And nothing is ingrained in stone. Things could change. The plan that we outlined, is subject to some modifications depending on the scenario. But at least this gives you a good snapshot of how things may progress throughout the community. With that, I'll stop there and let you know that this information will again be disseminated. There'll be more information forthcoming on each one of the measures. And if things are going to be changing in the community, we always reach out to, obviously, Facebook Live has been our main thing. Great partnership with K103 and our local media. We'll be putting out information in there so that you can have a quick reference to any information that I outlined here. So with that, again, Kahnawake, now is the time for us to be extra vigilant. It's time for us to remember the measures that are currently in place, stick to them, live it every day, and what we do today definitely has impact on what can happen tomorrow. So be safe. Nyawagawa.
Thank you very much, Lloyd. When we do these updates, sometimes they can be pretty quick. Some of them are a little more complex. Today, obviously, it's very important that we get a lot of information out there. There's some new information, some new strategies. I know that some people just don't want to be sitting in front of their screen for 5 minutes or 10 minutes. So that's one of the reasons why that one of the initiatives that is going to be taking place in the next few days, actually, is the daily, we're going to just put out a brief update on the status of Kahnawaga's situation, whether it's orange or whether it stays yellow. Let's hope it stays there. And that status report in the morning will be very brief. So for those who just want that little bit of information, there you go. And so we thank you again for your patience. Joining us now from the Kahnawà Memorial Hospital Center and a member in good standing of the COVID-19 task force, she'll add to some of what Lloyd was talking about here, is Lisa Westaway. Lisa.
Thank you. So I'm going to review again today some of the strategy that we're going to be implementing for visitation at KMHC, and you will be hearing a little bit more details about the Elders Lodge and ILC next week. But first, let me just go back to the reason why we're ramping up our planning, why we're talking, why we're doing Facebook Live more often, why we're working on our communication strategy. And it's really because of what we're seeing around us. And just a reminder that we are in the second wave of the pandemic, and we are at a critical phase in order to determine determine our future. So it's very important that we remember that these measures are being implemented for all of our safety, and we are in control. So one of the major issues leading to anxiety, especially during the pandemic, is the feeling of a loss of control. We are in control of what we do. We are in control of how this pandemic will impact us, and I think it's really important to remember that aspect. Our control is in our daily behaviors. Our daily behaviors will control whether we can celebrate Christmas with our families. I know that that was mentioned today in a press release, but it really stuck for me. It hit close to home. What we do now, what we do over Thanksgiving, what decisions we make when we walk out the door now will impact if we can have Christmas with our family or not. And it may impact whether our loved ones will be sick, will be hospitalized, or may die. And it seems drastic, but it's urgent, and it's important that we continue with masking, hygiene, and social distancing. We are in a good place now. We've worked really hard, and we have to continue to maintain that despite the fact that we're fatigued, despite the fact that we don't want to hear about COVID any longer. We have to continue with these measures because everywhere around us is increased death in long-term care facilities, increased hospitalizations, hospital rooms are filled. We haven't spoken about these elements in a really long time, but they are around us right now, and they are increasingly worsening in the cities around us. So we have an important decision to make about what we want for our futures, and we have to do that right away. So Lloyd spoke about our planning for the next few months. And the goal of that is to allow the community to see how we're preparing, what are the elements that we look at that help us make decisions about directives that we put in place. And so that is so that you can be a part of this movement with us. So in the first wave of the pandemic, we made very many quick decisions without advising on the reasonings why necessarily, although we did communicate quite a bit, but it wasn't always easy to communicate all of the information. So the idea behind the communication plan for planning is that you are always aware of where we're going and what's happening. So the same can be said for visitation at KMHC. As you remember, from one day to the next, we pretty much closed our doors to visitation, and that had drastic impacts on everybody, staff, residents, loved ones, the community as a whole. And so and since then, we've been able to gradually open up and recreate and relive our relationships in a semi-normal way. But we have to plan for the future, and our goal is to not just simply close the doors. So I've already presented this yesterday, but I still want to go through it again today. And the first part that I want to mention is, as of Monday, so the 28th of September, we will no longer be having outdoor walks. So that is the first element that is going to be scaled down in the visitation at KMHC. And the reason for this is a result of the increase in COVID-19 cases in the communities surrounding us, and the fact that we don't live in a bubble, and we continue to leave the community and have opportunities, which is okay, it's normal, but we continue to have opportunities of increased contacts, and this adds an extra element of risk to our most vulnerable population at KMHC. Therefore, we still will have visitation. So if you look at the table, we are right now in the yellow section, and that goes the same for the plan that Lloyd presented to you. We are in yellow right now. And therefore, We are having the off-grounds visitation walks. We're having visitation in residence rooms, visitation in the outdoor courtyards, and sometimes outside of the units in outpatient area. We have visitation for end of life, and we also have support and visits that are happening from natural caregivers. So we remain in the yellow. As I mentioned yesterday, and this is important for both plans, we will not necessarily switch from yellow to orange to red, with all elements moving from one color to the next. Sometimes within a color, within one of those phases, we may make changes, and that's as a result of what we see around us. So, for example, if many cases are stemming from gatherings, we may simply change the amount of people allowed to meet in gatherings, but within the same color. So that's important, and that's why, although we remain in the yellow right now, we are going to stop the off-ground visitation. So one thing I want to remind you about the visits, this is super important. We have you sign an engagement letter, a consent form, and an engagement letter when you come in for your visits. The reason for this is because we have expectations and rules that family members need to follow. These are rules for safety. They're the only reason why we would want to have rules in place for your visitation. It's in order to mitigate risk, because no matter what the visit is, whether it's outside, whether it's in the courtyard, or whether it's in a patient's room or a resident's room, there is always risk. And so our role is to help guide you and support you to be able to implement the rules when you're having your visit. We still have some family members or friends who are not respecting the rules, and I just want to make sure it's clear that should we have repeated situations where people are not following rules, that we will have to stop those people from visiting. So it's not a fun situation that anyone wants to be in, but our utmost importance right now is to ensure that our residents are safe. So when we move to orange, and again, you'll be advised of the change from one color to the next as it happens, because you'll be getting these notices, as Joe mentioned, on a day-to-day basis. When we move to orange, you'll see that we are scaling back slowly in the same way that we opened up visitation. And so there are just a couple of elements that change from yellow to orange. And when we move from red, this is pretty much a situation where our doors are closed to visitation, and therefore you only see two areas there, which is visitation at end of life and support by natural caregivers. So the support by natural caregivers is a bit of a change from when we closed our doors in the first wave of the pandemic. A natural caregiver is somebody that provides daily or on a regular basis support to one of our residents for any activities of daily living, so feeding, cleaning, hygiene, feeding, any activities of daily living, and who does so on a regular basis, and also could be considered support for psychosocial support on a regular scheduled basis, almost like a caregiver, a hired caregiver sometimes that some patients might have, who come on a regular basis to provide specific elements of support. So in the first wave of the pandemic, natural caregivers were not permitted to enter into KMHC. However, one change that we're making to the benefit of those residents who receive regular visits from natural caregivers is to maintain that aspect even when we get to the point of closing the doors to all visitations. So if you are a natural caregiver, you may have already been reached out to by one of KMHC's employees, and there is very specific required training that's involved in this practice. So we'll be getting in touch with you for that matter. So this is the plan for closure of visits for KMHC. But what I wanted to talk about today is also some of the services and activities that we maintain throughout the different colors, because although the actual visits might change over time depending on what's happening around us, and hopefully we stay in the yellow until the end of all of this. But there are many activities that will be maintained, and that's important. So right now we're in the yellow, so I wanted to just give you a bit of a look at what we have in place right now at KMHC. So we do have our hairdresser that comes in, and so there is hairdressing. As many of you know, this is very, very important to our residents. We have the legal or financial visits at KMHC. We have family members who are able to clean their loved ones' clothes. So during the height of the pandemic, as you know, we had to stop that. We have food and item drop-offs happening every couple of weeks in a safe way. Dining in the dining room with physical distancing, that is happening right now. So as you know, when we were in the red in the height of the pandemic, residents were eating by themselves in their rooms if they were able to. There are virtual visits still happening if required. So if family members or loved ones who live far away aren't able to come in, virtual visits still continue. There are group activities that have started up again, of course, in a safe way with physical distancing. Many more medical appointments taking place. Physio, OT, social work sessions, all of these elements have been reinstated and are happening on a regular basis. When we move to the orange category, there may be some changes. For example, we may start to limit the amount of people that come in onto the floor for safety reasons and control, of course, of mitigating the virus and transmission of the virus. So we would remove the hairdresser, for example. And so as you see, there are many activities that continue despite moving from yellow to orange to red. So we're going to post this so you'll be able to take a look at the different elements, and we will probably add some in as we go along. We're also in the process of doing a pilot project with Class Dojo. So Class Dojo is a communication tool that's used in the education system that facilitates better communication between the school and the child's family. But we are using that type of a communication tool as a pilot project at KMHC between family members and their loved ones or their loved one's worker, so the activity worker, the social worker, or the nurse, in order to provide more continuous communication, communicate pictures, and really try to have a better type of process in place so that you know what's happening with your loved one on a regular basis, something a lot easier to use and more daily than the iPads that we were using before. So that pilot project is in place, and we hope to set it up shortly for all if the pilot project goes well. So that's something new that we will be implementing shortly. So that's a summary of what's going to be happening. The plan, again, will be posted along with the task force planning. And again, a reminder, hygiene, distancing, and masks, super important. Thank you.
And Nyalko, Elisa, I think it's very important that she clarified something, because plans are there. There's tons of work that has gone into it, but what you see as the basic guideline, whatever is in yellow, in orange, in red, some of these will slide over. So it shouldn't be looked upon as a legal document saying, you know, like, for example, if no more hospital visits, but it doesn't say that here. It's the guideline to give you the general idea of how things are in Kahnawake. So again, thank you for taking time to stay with us today, and you will be able to go and see some of those documents as Lloyd indicated. They should be out very shortly. We will have some other initiatives coming up next week. And before we leave, just like to say Nyalko to someone who has been on this program on several occasions to help bring us information that is needed on nursing care and general information about the COVID-19. Leslie Walker-Rice had her last day at work today at the Catherine Memorial Hospital Center. She worked in infection control and community health, and after a very long and stellar career, she leaves us. So I hope she has a good retirement. I know she will. And from all of us here at the task force, thank you for what you've done. And for all of you watching today, Nyauko Adano, Onigiwahi.